Welcome to Let's Get to Work, Reimagining Disability Inclusive Employment Policy, brought to you by the Burton-Blatt Institute at Syracuse University. And now, here's your host, Michael Morris.
Welcome to our podcast series, Let's Get to Work, Reimagining Disability Inclusive Employment Policy. Researchers at Burton-Blatt Institute, Syracuse University, in cooperation with other leading researchers at Rutgers and Harvard universities, are studying a range of federal and state public policy issues to improve our understanding of the latest trends and thinking to advance workforce development and employment outcomes for youth and adults with disabilities. Our podcast series features outstanding guests with unique knowledge and insights about a range of issues impacting disabled individuals, job applicants, and workers. Today, our topic is going to be long COVID, and I'm pleased to say that we have two outstanding researchers from the University of New Hampshire, Vidya Sundar and Debra Brucker. I think I'll start with first congratulating both of you on your relatively new NIDLRR-funded Disability and Rehabilitation Research project on living and working with long COVID. Maybe we can start with Vidya in terms of, even before you get into the research agenda, what drove this collaboration? You've collaborated on multiple projects. Was there something driving this particular one in terms of motivation?
Thank you. We are really fortunate to be funded by NIDLRR for this particular project. I will say, in terms of what our motivation was, you mentioned that Deb and I have worked on multiple projects, so we both have common research interests in terms of addressing employment issues for people with disabilities. When the COVID pandemic happened, we recognized the need for some individuals who were experiencing long COVID, who had to make significant adjustments to their work life, and that was increasingly becoming an issue for the general population, and then more specifically for people with disabilities. Sometimes they're treated as a niche population, and we were acutely aware of the needs of this specific population. And around the time the COVID pandemic hit, we were also in the process of almost halfway through our previous research grant, which was on job crafting. I realized, maybe we'll talk about this later, but it was really seeing the opportunity of extending some of our work to patients with COVID and long COVID.
Excellent. And can you kind of move from there to kind of provide a brief overview of this is a 5-year project, kind of lay out the framework for your research?
Sure. Like you said, this is a 5-year project, and Deb and I hope to use multiple research methods to understand what really long COVID is first, and then how to understand how people are living and working with long COVID. So there are almost like two components, two arms to our study, which is how people manage their symptoms, what is their access to healthcare, et cetera, and then the employment piece. As far as how our research activities are structured, we want to start with what is called participatory action research, which is really engaging with our consumers who have long COVID and thinking about them as partners in this process. And we plan, during the first couple of months, we're planning to do a few focus groups that will we'll engage with people with long COVID who are currently working, people with who are not working but may have lost their job either during COVID or for long COVID related reasons. And then another focus group with stakeholders, employers and healthcare professionals, to understand how they work with employees with long COVID. So the first few months we're really spending understanding, partnering, and working with our constituents, which is really individuals with long COVID and other members who might be working with them. Beyond that, we're going to be looking at how we can leverage big data, some of the national surveys that we have on long COVID. And Deb is in charge of those projects. She's leading a couple of projects that looks at that uses nationally representative data to understand the risk of long COVID and then how people live with long COVID. We're also using the health all-payer claims data as one of our sources, and Deb can go into details, specifics about those two projects. And in the last few years, we have an intervention study planned, which is sort of like transitioning from the living aspect to the working with long COVID, where we're extending some of our previous work on using job crafting as a strategy to address symptoms of long COVID at work. And then finally, to wrap things up, we're doing a systematic review in year 5, which will address prevalence and incidence of long COVID at that time. And our sort of thinking behind doing the systematic review at the very end is that, this is still evolving. There's still research coming out about what long COVID is, what people experience. So we want to make sure that the field matures over the next 4 years, not matures, there's some more research available over the next 4 years for us to be doing a systematic review.
That's very, very helpful. What we know is the people are still getting COVID. We know that, unfortunately, the numbers are growing in terms of people with experiencing a variety of symptoms that would be described as long COVID as well. And maybe for our audience, which is pretty diverse, turn to Deb in terms of talking a little bit about what are some of the common symptoms of long COVID.
Thanks, Michael. People with long COVID have a wide range of symptoms, and these can last weeks, months, or years after their initial COVID-19 infection. The symptoms could include tiredness, fatigue, fever, difficulty thinking or concentrating, what is termed often brain fog, dizziness, depression, anxiety, joint or muscle pain, gastrointestinal issues, a whole range of symptoms.
What percent of adults in the U.S. are experiencing long COVID? What do we know? We're still learning more, but what can you share with us?
So estimates vary, but a report that the Kaiser Family Foundation put out in 2023 estimated that 15% of all adults in the U.S. had long COVID at some point, and about 6% currently have symptoms of long COVID.
What are the characteristics that increase the risk of being impacted by long COVID?
So we know from a physical standpoint that people had a more severe COVID-19 infection are more likely to have had long COVID. So if they were hospitalized or intubated while they had COVID-19 infection, people had underlying health conditions are more likely to have long COVID. And people who were not vaccinated are more likely to get long COVID. What one of our studies is interested in is also looking at the socio-demographic characteristics that might be associated with a higher risk of having long COVID. And for that, we plan to look at data from the National Health Interview Survey to try to look at whether there are disparities in long COVID prevalence for people with disabilities by these socio-demographic characteristics such as age, race, gender, urban, rural status, poverty status.
Will it also be able to show differences in terms of people with different types of disabilities, being the possibility of long COVID being a greater possibility?
To a certain extent, we're just starting to get into the data. There's limited information about different types of disabilities within that data set, but more and more national household surveys are starting to add information about long COVID as a question. So I could see in future years that we would be able to drill down more in specific types of disabilities.
Okay. And both of you are very experienced researchers on employment-related issues. So I think I'll go back to Vidya. What do we know so far? You're going to learn a lot more over the next 5 years, but what do we know so far about the impact on employment of individuals with disabilities who experience long COVID? What's ahead in terms of, well, first, I guess you've done some sample studies prior to this grant. Talk about that, and then we can look at what's ahead.
So yeah, that's a great question. The previous NIDLRR grant that we had, a 3-year field-initiated grant, really focused on using job crafting as a strategy, a self-management strategy to help individuals with various disabilities navigate their demands at work. I will say job crafting was a strategy that was developed more within the management and organizational psychology field. And, traditionally, it's something that we think of an employee-initiated strategy that is used to navigate, refine, redefine their job tasks. Our grant focused on how we might use this strategy, adapt this strategy for use with people with disabilities. So specifically, we looked at how you could deconstruct your job, think about your job as the tasks that you do, who you interact with, and how you think about it. And are there opportunities to tweak some of these in a more informal fashion so it aligns better with who you are, what you're passionate about, what your strengths are? And the thing that was really intriguing for us about job crafting is that it can be used even when people with disabilities specifically, are not ready or willing to disclose about their condition. So it is, I would say, it's an identity blind strategy. It can be used it can be used in a situation where you have a specific disability or you don't, with or without disclosure. So we looked at the effectiveness of job crafting by using a coaching-based strategy, where we had a research team and members of a research team coach individuals with disabilities about how they can think about their job differently, how they can maybe use certain accommodations to perform their jobs differently, how they can request for accommodations. When I say accommodations, it could be both the formal ADA definition or just informal accommodations where you're negotiating with your colleague. Hey, I need to do this. Would you be able to, swap something with me so I can do this part of the job and you do something else? So those types of informal accommodations are very much a central core of the job crafting strategy. And like I mentioned before, while we were conducting the study, the COVID-19 pandemic hit, and we were right in the middle of our recruitment. We were probably about halfway through with our recruitment. And when COVID hit and people had to quickly transition to working remotely, to social distancing, we saw this increased need to use job crafting. And we felt like that could be a helpful strategy for people to adjust to these new working conditions, right? When we were all social distancing, back in the early days of the pandemic, there was really no opportunity for social connections. Thinking about that piece, how you might derive some meaning from social connections at work was also a critical part of our strategy. So we're sort of wrapping up some of the data and analysis from that particular study, and we noticed the value of using job crafting, continuing to use job crafting for individuals with disabilities, and then sort of extending that to individuals with long COVID as well.
And let's dig a little bit deeper into job crafting, which is a relatively new term to me and probably to much of our audience. There are multiple dimensions of job crafting. Can you talk a little bit more about that?
Sure, absolutely. And again, I will say there are multiple theories or multiple approaches to job crafting as well. The one that we sort of subscribe to is thinking about job crafting in 3 different ways. The first one is task crafting, which has to do with tweaking, modifying how you do things, not what you do, but always, but how you do your job tasks. The second one is relational crafting, which is refining, redefining who you interact with at work and why you interact with them. And examples of this could be individuals seeking a mentoring relationship with someone that they would like to work and learn new skills from, or maybe someone in higher up in the organizational hierarchy wanting to mentor someone else, a junior coworker, so that they could offload some of their traditional responsibilities eventually to the junior coworker. The last one is cognitive crafting, which is thinking about what your job tasks are, how meaningful it is, how it really contributes to your sense of engagement in the workplace. We all have certain tasks that we enjoy about our work and certain tasks that we all hate about our work, if I can say that. And cognitive crafting allows people to think of the big picture and say, okay, I have to do this task. I may not like it, but it'll help me accomplish something else. And it's sort of that reframing that some of us have to do to be able to do things that may not be well within our, skill set or passion sometimes.
And you mentioned that this approach, this type of intervention, is relatively new for individuals with disabilities. Do we know enough to know at this point, would workers with disabilities craft differently than workers without disabilities?
That is a great question. We have some theories, some hypotheses, like preliminary hypotheses about how workers with disabilities might craft differently. And we're really curious to be thinking more deeply about that and to test that in our future studies. So when you think about job crafting and why people might make some tweaks to how they do their jobs, what they do as part of their jobs, you can think about, two different approaches. The first one is what we would call a promotion-based job crafting, where, I'm looking for better opportunities. I'm looking for a better fit between my skills and, what my work demands of me. I can think of, someone who absolutely does not like public speaking might intentionally stay away from those types of activities, may not volunteer to do that. Someone who is really good at party planning might want to take on some activities related to organizing events at the workplace, right? So we innately do some of these things, knowing what our passion, skills, and strengths are, and trying to align that with our job tasks. When we do that as part of wanting to expand our skills and wanting to sort of take on more responsibilities, we call that promotion-based crafting. And the other end of that is prevention-based crafting, when we're trying to preserve what we have. So, even for a person without a disability, sometimes work can feel too stressful and too overwhelming, and we're trying to sort of manage what we have, what our expectations are, and we may choose not to engage in certain types of works because it's overwhelming for us. And for people with disabilities, that could be an extra layer of managing their symptoms and sort of preserving that existing job demands in a way that they don't feel too overwhelmed. So if we think about what the differences are in terms of people with and without disabilities, we strongly feel like there is a tendency for people without disabilities to engage in more of promotion-related strategies where they're looking to expand their career boundaries. Versus people with disabilities might be choosing to preserve or stay in the current situation, the current setup, where they're preserving and trying to add on to existing demands. So I would say in summary, we think that there might be a tendency for people with disabilities to engage more in prevention types of job crafting rather than promotion-related job crafting.
And it would seem to me, again, it's a new topic for me, but that crafting might be limited by the types of occupations or industries as well. Do we know enough at this point to whether that is true?
We know some things from the research with the general population, not necessarily with people with disabilities. And again, the research that I've sort of read over the last few years about job types, they're not specific to industries, but the characteristics of the job. So naturally, jobs that have a little bit of autonomy, where people can take that initiative and do that extra bit or choose not to do something, they're more conducive for job crafting. If our work is highly structured, that I'm expected to punch in at a certain time, finish 1, 2, and 3 tasks, and I really don't have that latitude to take initiative in my workplace, it may be more difficult to engage in job crafting. I also think sometimes, entry-level professionals may not feel ready to engage in job crafting because they're still learning what their job demands are. They're still learning the culture of the workplace. It takes us a few, months or years to feel comfortable in our role and then be able to sort of advocate for ourselves for how we see our skills and passion aligning with what we're expected to do at work.
And maybe just as a last follow-up is, it would seem that this notion of crafting has to be a very interactive process with the employer, the supervisor. And from what you have already learned, is that true? And how does one build that out further?
Absolutely. Although job crafting is employee initiated, it is very much a process that needs synergies between the employee, the supervisor, and the coworkers, right? So, as I'm crafting my job, I have to be conscious about, well, am I stepping on and overtaking someone else's job roles? Will my supervisor approve of these sort of self-initiated changes that I've done? And in the research world, there are definitely studies that have looked at dyads of supervisors and employees who co-craft, right? So together, it's used as a coaching model to help them advance in the careers and identify areas of strengths and skills and passion, etc. I would say it's definitely something that requires sort of a collaborative approach for it to be successful. However, in our previous studies, we've used it as a framework for empowering employees. Because of the limited scope of our study and we did not have access to companies or supervisors, we had to be really careful in terms of making sure that the employee does not, disturb the balance of, how the work tasks are being assigned between the coworkers. In that sense, we were really careful thinking about non-essential job functions versus essential job functions, right? So we don't want someone to be crafting within their essential job functions. These are things that an employee is being paid for to do. So, disturbing that sort of requirement where you're responsible for doing certain thing does not work within a coaching-based environment. However, it might work within the dyad setup that I talked about previously, where supervisors and employees are co-crafting. But our previous study was really limited to the non-essential work functions.
Thank you, Vidya. Let me go back to Deb, and there are other research activities in this planned agenda over the next 5 years that will further look at employee and employer interactions. With the increasing number of individuals with long COVID, will you be trying to identify the evolving employer attitudes, policies, or practices that will help increase the retention of workers with long COVID?
So as Vidya mentioned earlier, our beginning project is participatory research, where we'll be conducting 3 different focus groups. And the first 2 include workers who have disabilities and long COVID. One group will focus on people who are currently working and have a disability and long COVID. And so we're interested in how they are navigating the workplace, what strategies are helpful for keeping them employed, what policies might be helpful for keeping them employed from their perspective. We have a second focus group that will focus on prior workers who have disabilities and long COVID, but perhaps had to leave the workforce because they developed long COVID. And so we want to understand from them, what was the tipping point? What about their workplace environment perhaps was not conducive to them managing these additional symptoms while they're on the job, understanding how they made that decision to leave the workforce, or what could have helped keep them employed from the employment workplace perspective. And then we also are going to conduct a third focus group that will include employers as well as employment support professionals. So we will be including supervisors, people from human resources, people from vocational rehabilitation, to understand how these people that support the employment of people with disabilities are helping them succeed in the workplace to manage long COVID.
And will you also be looking at, you could learn this from those 3 focus groups, targeted audiences, will you be also studying the kinds of accommodations that have been successfully negotiated by workers with long COVID who meet the definition of disability now under either ADA or Section 504?
We hope that the focus groups with the employees in particular will help us understand what accommodations were successful, and then also the ones that left the workforce, maybe perhaps how those accommodations were not so successful in helping them stay employed. Be very helpful to get the perspective of actual people with disabilities who have long COVID. And also, as I mentioned earlier, the symptoms of long COVID can be so diverse that we would expect that one accommodation that might be helpful for one person is not the same type of accommodation that would be needed for someone else who also has long COVID. So we're interested in hearing more about that from people who are experiencing this.
It seems that with what we know about long COVID now, symptoms can be fluctuating. They change, they evolve over time. Will you be looking at not just individuals with disabilities or, a pre-existing condition of disability, but individuals who move from having COVID to long COVID and then become disabled? There's a difference between the two. And so there's only so much you can do within the framework of your focus groups. It may be things you could pick up from the systematic review, the last phase of your research. But what are some of your thoughts about that?
That's correct. As we initially designed our plan of study, and given that this was funded by NIDLRR, their interest, from our understanding, is on people with disabilities who acquired long COVID. So people who already had some sort of disability and then acquired long COVID. So that was the focus of the studies that we designed. But I would expect, as you mentioned, particularly for the systematic review, that we will have more information about that population, and perhaps in some of our other studies as well that may come up.
Okay. And let me return to Vidya. What do we know at this point anything further about kinds of employer practices that could help people with long COVID stay on the job, work more hours, be more productive? And are there certain inferences based on your research hypotheses that you might be able to share with us?
Sure. In terms of hard evidence about, strategies that might help workers with long COVID, I think we're still in the very early stages of understanding and knowing that. We have been living with long COVID for at least a couple of years now. And most of what we know works well are either from some preliminary studies or from anecdotal evidence from employers, clinicians. The Job Accommodation Network has recommendations for what types of accommodations or informal supports might be helpful for individuals with long COVID. And as you can imagine, most of those center around addressing some of the neurological or fatigue-related symptoms. Things like flexible work schedule, flexible organization of work. We think of work schedule as start and end times. It doesn't have to be just that. The ability to restructure your work tasks. So I get to do my most difficult, sort of challenging tasks in the morning, and I set aside some of the easier tasks for later in the day when fatigue might set in, allowing for breaks, more frequent breaks, allowing for hybrid work situation. We're very used to working in a hybrid type of setting. So those are some of the things that seem to be helpful, helping individuals who experience those brain fog like symptoms, the cognitive symptoms. Because the symptoms of long COVID it's so varied, it's hard to come up with a discrete set of strategies that might help all individuals with long COVID. At this point, it's mostly thinking about the symptoms of long COVID and how those symptoms sort of overlap with job demands and how you might optimize managing symptoms and the job demands.
You have hypotheses, you have a research design, but there's always the unexpected. What, in terms of a takeaway, if you implement your design, you have 5 different parts. What do you hope we learn? What's the additional knowledge that is going to both inform future research, but I think also have an impact on policy and practices, employee interactions as well?
I think ultimately we're hoping that our intervention will be useful to people with disabilities who have long COVID and helping them sustain employment and achieve success in employment. And it is a low cost type of intervention, employee driven, which we think has benefit and can be adopted broadly without the support of external people, working with the person with a disability and long COVID. Among our other studies, I think we're hoping just to highlight perhaps some of the disparities that people with disabilities might be facing in terms of having long COVID and their access to healthcare, the socio-demographic characteristics that might have increased their risk because, for example, they were living in areas where they might not have as ready access to healthcare, and just helping to move the research forward for this population that's also experiencing long COVID.
That's a great kind of putting it all together, the pieces here. Vidya, anything you'd like to add?
Yeah, I agree with everything that Deb said. And, one thing that if I could add would be stepping back a little bit, even something as basic as understanding what long COVID is. Sometimes we hear in the media that some people even question if long COVID is real. And that's one of the reasons why we start with the participatory action research, so we can hear directly from advocates who might experience long COVID and disabilities specifically. Right? So it's almost like the double jeopardy of having long COVID and then having pre-existing disabilities. So one of the first things we hope to learn is the extent of long COVID symptoms and disability and how they interact and influence what a person does on their day-to-day basis, like the living and working theme, right? So even getting to the basic understanding of what that might be, that's another additional goal.
Okay, I think we've covered a lot of ground. Anything else you'd want to share with our audience that helps them fully understand this very, very important NIDLRR-funded research project on living and working with long COVID? I'll start with you, Vidya, and then go to Deb.
Well, first of all, I want to thank NIDLRR for giving us this opportunity to explore this work. I think it's much needed. I think it's timely, and it addresses, NIDLRR's priority in terms of focusing on people with disabilities who sometimes can be forgotten when dealing with pandemic. Most people are focusing on the majority of the population, but our core target group is individuals with disabilities. So I'm excited to be able to do that.
We will be recruiting for our focus groups and also for participants for our intervention later on in our project. And so, we can share information with your group to disseminate perhaps to your followers or your listeners if they're interested in contacting us and possibly being included in these studies. That would be great.
A question I meant to ask, and I'll ask it at this point. The disability population is very diverse. To what degree can you infuse the whole notion of intersectionality and in terms of the yet a further dynamic to people experiencing long COVID with disabilities.
We look at intersectionality in terms of, there's already intersectionality between long COVID and disability, right? And then depending on how much data we have, we could slice that a little further in terms of looking at adding other pieces of intersectionality. Would you say that's accurate, Deb?
Yes, and one of our projects in particular, using data from the National Health Interview Survey, will have a large enough sample that we're hoping to drill down and look at the intersectionality among these different vulnerabilities that people might experience at the same time. So someone with a disability who has long COVID, we want to understand, are there gender, race, ethnicity, poverty-related issues that are all entwined and might have impacted their risk of getting COVID and long COVID. And that data set in particular, includes information about gender orientation, which is useful for some of this intersectional analysis we'll be doing, as well as some detailed race and ethnicity information.
And Deb, can you share with our audience, where can they follow? You're at the early stages of this research. A website, or particular, how can they be a part of this? You both talked about they might be potential individuals to participate in the focus groups from one of the three categories. But where do people go to learn more?
So our website is in development, but we have a landing page we can direct people to, and it's sites.usnh.edu/power, POWER/.
Again, it's just a great appreciation that you both joined us at this point. There's so much going to be learned over the next few years. We hope this piques the interest of our audience to follow your work, and for all of us to continue to gain a greater understanding about the impact of long COVID on people with disabilities in terms of employment and productivity. So thank you both for being with us today, and we look forward to learning more as your research begins to be implemented. Thank you.
Thank you, Mike, for the opportunity.
You've been listening to Let's Get to Work, Reimagining Disability Inclusive Employment Policy, brought to you by the Burton Blatt Institute at Syracuse University. Don't forget to subscribe to the podcast at Apple Podcasts, Google Podcasts, or wherever you listen to podcasts.